So what you can see here is step one. Now what I've done, Nika doesn't have back pain. She's our lovely, delightful Pilates teacher. But what I've done is I've marked on her back the erector spina, so that's the two rods when your back feels locked. And I'm doing step one, where I'm just getting her to rock onto her heels and try and relax those two rods in her back. Okay? If you've got back pain at the moment, you might want to try that. Right, now step two, what I'm getting her to do there is to put her hands on her rib cage to try and get her breathing to calm down out of her neck and shoulders. And she's doing that excellently. So you can try that yourself and try and expand across your back, still keeping your back extensors relaxed. Okay, next one we're doing is I'm getting her to do the diaphragm breathing from the front there and getting her to relax her upper traps. You can try that. So you just find a position where your shoulder feels a little bit more comfortable. Sternocleidomastoid. Still maintaining the breathing, still altering where your centre of gravity is so your back extensors are relaxed. Now we're going to start some core training. So the first thing is it's good to put your hands on your upper abdominals. I've got them there on external, internal oblique, and on your lower abdominals, because your automatic reaction is you want to suck your tummy in. But your goal is go back through your step one, step two, just alter your centre of gravity a little bit of postural sway I call that, and try and keep your upper abdominals relaxed, still breathing, and start to engage pelvic floor muscles, like we felt when you were just initiating getting up out of the chair. Right, lifting your whole spine up and out of the pelvis. She did that excellently, by the way. Okay, we've added flutter to that. And you can do this just throughout the day, just when you're standing. Probably don't do some of these in public, I'd suggest. Okay, and here we go again. We're doing the same thing again. All right. Getting the core to be activated, but actually keeping the back extensors relaxed. So finding where, and this starts to activate multifidus. So what she is, she's got her fingers between erector spine and the spinous process. I'm getting into it. You'll feel a little bit of a hollow there if you've got back pain. And you want to fill up that hollow, a little bit of flutter, a little bit of perturbation, and then just relaxing. Last one, all right, starting with just automating your core muscles, getting your confidence up to move more normally again. Fingers together, you'll feel that straight away if you're trying this now. You'll feel your core click on straight away. And then pretending you're sitting on a chair, you really need to work this 4 or 5 times or so. Okay, and then you should find that your back pain starts calming down. So throughout the day, you can put all that together if you look at the summary of those 4 things. 1, changing your centre of gravity, just relaxing your back extensors. You'll find this doesn't take long, 2 or 3 times a day. Breathing, diaphragm breathing, relaxing your neck and shoulders. All right, relaxing your neck muscles. You get a shock how often during the day you tighten your neck and your shoulders are, and your jaw as well, and how that tightens up your back. Lower abdominals, at the bus stop, walking down the street, thinking tall, a little bit of postural sway, adding the flutter, adding the perturbation, I call that signal. And the last ones you should be organised by now is finding deep multifidus. Trying to feel, you feel a little bit of swelling under your fingers as you just sway onto your heel bones. A bit of flutter. Signal, keeping that muscle activated. And the last one is your squats. So there's no reason why you can't do that 2, 3, 4 times throughout the day.